I thought we would start this series with the hip joint. I feel this is most commonly talked about, if for no other reason than hip certifications through OFA have been around forever, since like 1966. I also feel that it is one that is very misunderstood, probably for that very reason as well. When we take a look at the hip, it is a ball and socket joint made up of the head of the femur, that's the ball, and the socket portion being formed by the hip bones. It's also secured by a ligament that connects the head of the femur, so it comes right out of the head of the femur, maybe you can see that little hole there, and back into the hip. And so this is represented by this little string here. And then the whole thing is held together by a pretty substantial joint capsule that brings everything together. When it's well formed, it is a pretty secure joint that functions like it should. It's also a joint that when it's healthy at the start rarely deteriorates or develops arthritis in the absence of other issues in our canine patients. Let's talk about these screening tests first. The most familiar hip certification is OFA. This is a single x-ray taken with the dog on its back with its legs extended. It's submitted to OFA, which in turn sends it to 3 radiologists, and the score is generated from these opinions. While we would like to think these readings are objective, having done this long enough, I will tell you there is certainly some subjective opinion at play. While it's a good system, it isn't necessarily a great system. There is dispute as to whether the film should be taken awake or always under sedation. Currently, both are allowed. I'm of the opinion that it doesn't influence the conformation as greatly as keyboard experts think it does. The argument is that in a awake dog, hips will be tighter due to those muscles being activated. The truth is that with a dog sedated, you can oftentimes manipulate the hips into a good position. At the end of the day, great hips are going to be great hips. It is the borderline hips that I worry may be influenced through positioning, but I think that can be awake or asleep. It is the disadvantage of using one view, so the straight on view, when we're talking about a dynamic three-dimensional object to make such an important decision. The other major hip certification is pen hip. In this method, the dog is under anesthesia. That same hip extended view is taken for pen hip like it is with OFA, but in addition, the legs are positioned to the sides and a compressed view is taken and a distracted view are taken, and a distraction index measurement of the differences there is obtained. This is a measure of the hips being distracted from the joint. This number is reported in comparison to the breed averages, so you are getting a comparison of your dog to others within the same breed. The other big benefit of pen hip is that it can be done as early as 4 months of age. While you can do a preliminary OFAs early, the actual certification cannot be done until a dog is 24 months of age. Early in my career, there was a fair amount of variability in these numbers from pen hip in the breeds with smaller populations. Even in breeds like German Wirehairs, which are relatively common now, back 20 plus years ago, we would see this DI reading shift from year to year as more dogs were added to the database. Now, with most of the common hunting breeds, I'd feel pretty comfortable with these DI assessments. You will still have some naysayers poo-pooing pen hip, saying it is polluted with dogs that failed OFA, thus dragging that DI down. I'm not convinced this is a real issue with the common breeds, though it can be an issue if you have an obscure breed and the reported population is still relatively small. My typical recommendation to my breeder clients is to do both. You will have most of your clients familiar with OFA, so you can check that box, but pen hip offers the ability to judge a dog's health clearances earlier and allow you to make breeding decisions much earlier in a dog's life. Now, don't mistake this for saying I'd breed a dog any sooner, as that's not the case. But what it does allow, if you are keeping a dog for a breeding program or you bred a litter from a dog with less than great hips, a pen hip evaluation can allow you to make some decisions much earlier in that dog's life. While rare, you can still have dogs affected with hip dysplasia out of excellent hip dogs. There are a lot of factors that go into the development of the joint, and is one of the reasons if I was a breeder, I'd never offer a health guarantee. I'd still do all of the clearances, I'd be an open book with my program, but I'd be very clear that at the end of the day, you are buying a living creature and things can go wrong. I'll never forget doing OFA films on a large Munsterlander that was out of 6 generations of excellent hips, only for that dog to have horrible hip dysplasia. Hip dysplasia is when the hip joint is not formed correctly. This can be either a shallow socket, a blunted head, laxity, or any combination that leads to a less than perfect ball and socket joint. The point I'd like to drive home, though, is that hip dysplasia diagnosed just on x-rays doesn't always equate to a dog that has problems. Every year, I'm referred a number of dogs for treatment of hip dysplasia, only to find out that the dog has no symptoms and the condition was discovered on x-rays. We will also have dogs that are athletic hunting dogs that come in for health clearance, only to find that this very well-muscled athletic dog has horrible hips. In these cases, it is vitally important to keep these dogs thin, muscular, and active. Oftentimes, I'll put together a therapeutic exercise program for dogs in an attempt to keep them well-muscled in that rear legs. It can be shocking to owners and even some veterinarians how normal these dogs can be as long as they don't start developing bony changes that change the dynamics of the joint. These dogs without symptoms are a big reason I advocate for early screening, especially for dogs that may come from suspect breeding, have a history of issues, or a dog with hip dysplasia may just be of concern. If hip conformation issues are caught before the development of arthritic changes, there are a couple surgery options for young dogs. If the condition is caught before growth plate closure, a juvenile pubic symphysiodesis can be performed. This is just a fancy term where this growth plate here is cauterized, which then changes the growth pattern of the hip and can result in better coverage over that femoral head. As far as hip surgeries go, it's relatively minimally invasive with great success. Unfortunately though, because very few of the dogs that would benefit are screened, it's rarely performed. In dogs that do have it, there is a concern that these dogs should be marked in some way to denote that they have had this procedure, either with a wire at the surgery site or some type of tattoo that designates it has been done. This is because after the procedure, there'd be no way for a radiologist to be able to know whether this was done. And without some type of marking, these dogs can be certified through OFA or pin hip and essentially cheat the system. The other surgery for a young dog is called a triple pelvic osteotomy, or a TPO for short. It was very popular when I was in veterinary school, but it seems to have fallen out of favor and we just don't see it performed that much anymore. Here again, the dog needs to be identified early enough before arthritic changes have developed, and too often dogs just aren't screened early enough for these types of procedures. With older dogs, there are two main surgical procedures we'll talk about as it relates to the hips. The first is a total hip replacement. I'll confess, I have no firsthand experience with this. While it is widely successful in humans, my understanding from veterinary surgeons that I highly respect is that this is a procedure you want done by the handful of people in the country that are really good at doing it. I don't say that to dissuade someone from pursuing it. I'm just saying it, if it were my dog, there would be research and discussion, and I wouldn't be scheduling based on convenience, location, and availability. It would be based on surgeon skill and experience. The other major hip surgery that will be performed in older dogs is an FHO, or a femoral head osteectomy. Basically, the ball is removed from the ball and socket joint. It seems like it'd be a simple procedure, right? We're just taking off that head. But I will tell you, as someone who sees a lot of these post-op, there is definitely an art to this procedure so that the remaining tissue moves as freely as possible and we don't get this bone-on-bone grinding. Here again, not everyone that can do the procedure does it well, and you want to find someone with good outcomes. The textbook take on these cases with an FHO is that they shouldn't be done on dogs over 50 pounds. And in this modern world of not looking at the world as gray, we will have people claim that the procedure shouldn't be done at all, and all dogs that need surgery should have a total hip. The truth is that the only option for some dogs to relieve their pain is this procedure. And I've seen many dogs over 50 pounds do okay post-op. One key point is that this is called a salvage procedure, meaning we have no choice and there is no one doing it once it is done. These types of procedures are saved for when other solutions have been tried with no other options available. The other key is that these dogs benefit from rehabilitation right away. We want them using the leg correctly as this tissue heals so that they aren't healing into a worse problem. In summary, hip dysplasia can be an x-ray finding, can cause issues with your dog, or can be something that never affects your dog. The important points are: screen a dog when it is young for best outcomes. Keep your dog thin, active, and muscular. Know there are treatment options, not just one treatment. And if I was going to choose one thing, drugs, surgery, therapy, for a dog with hip dysplasia, it would be to keep that dog at a healthy body weight and composition, meaning muscular, and not allow that dog to become fat. In the next video in this series, we're going to take a look at the spine.